How should I organize my post-surgery care?
Following cataract surgery, I usually suggest that people have somebody with them on the day of surgery. Your vision will be blurry when you immediately leave surgery, and you may have received sedation. So it's important that you have somebody with you at home on the day of surgery and overnight. And then I do suggest that people take a week off of work, but at the 1 week mark, people are usually resuming normal activities, including driving and going to work.
How can I address any discomfort after surgery?
Mild discomfort is expected following cataract surgery. I mean, you did just have surgery, but it is not typically a painful procedure and the recovery is pretty smooth. The most effective way to deal with the discomfort is to use your post-op medications. There are typically steroid medications and often non-steroidals as well, which can help reduce the inflammation and reduce the pain as well that is associated with the early post-operative period. If a patient is having severe pain, then they should see their ophthalmologist urgently, because that can be a sign of elevated pressure or infection, both of which are rare but do need to be addressed.
What should I expect in terms of vision immediately after the surgery?
Immediately after cataract surgery, I suggest to folks that it's sort of like being underwater. You can see, it's not that it's dark, it's not that you're patched, but your vision is blurry, and you should expect that for the day of surgery, your vision is going to be as if you're underwater and it is blurry. And then over the coming days, each morning you wake up and you notice that the vision is improved compared to the day prior.
What kind of long-term vision improvements might I expect from cataract surgery?
Following cataract surgery, the intraocular lens stays in your eye for the remainder of your life, and it is very stable in that configuration. So the vision is stable from a cataract standpoint. Of course, with age, there are other age-related conditions like macular degeneration, diabetic retinopathy, glaucoma, dry eye, just to name a few, which can develop or worsen as we get older, and patients should continue to see their optometrist or ophthalmologist to make sure those conditions are optimized and treated.
Will cataract surgery correct my close-up vision?
Cataract surgery is primarily intended to clear the visual axis. We're very fortunate that our technology is so advanced that we can address of patients' near vision. There's a couple ways to do this. Rarely, we'll use a monofocal lens to target for near vision so that a patient can read without glasses or use their iPad without glasses, but these patients would expect to wear glasses for distance, for driving, for example. And then there are presbyopia correcting intraocular lenses like extended depth of focus or trifocal lenses, which give you range of vision, and so a patient would be able to see far, middle, and potentially close without glasses.
Will cataract surgery correct my distance vision?
Most commonly, we do address the patient's distance vision, and so most patients who undergo cataract surgery have their cataract corrected, have the visual axis cleared, and they will have their distance vision corrected, so they're able to see far away without glasses. This means that patients can typically watch TV, go for a walk, or drive a car without glasses.
Can cataracts grow back?
Cataracts do not grow back. Cataract surgery is a one-shot deal, and that's what I tell my patients. Having said that, there is this idea of a secondary cataract, and what that refers to is there may be a little film that can grow behind the intraocular lens called posterior capsular opacification, and this is a not unexpected condition that can happen following cataract surgery and is easily addressed by your ophthalmologist.
What is the treatment for posterior capsular opacification?
So when a patient does get posterior capsular opacification, the treatment is simple. It's a simple laser procedure, a YAG capsulotomy, by which we clear the visual axis once again. So a patient does not need surgery if they get PCO, but simply a laser, which is an office-based procedure.
I had cataract surgery, but I don't like the lens I have. Can I replace it with a different IOL?
So when I counsel patients for cataract surgery, I typically advise them that whichever lens we select for implantation at the time of cataract surgery will stay in their eye for the rest of their life. And as a result, it's an important decision. In theory, it is technically possible to exchange an intraocular lens after it's been implanted and replace it with another, but this decision should not be taken lightly. This surgery does have risk and should be discussed with your ophthalmologist.